You're tuned in to the Brand Ambassador Select Podcast.
Hi, and welcome back to the Brand Ambassador Select Podcast, where we are building connections, showcasing the impressive, and inspiring movers and makers. I'm your host, Lenore, and today we're going to learn how a health and wellness company called Health Fairs Direct has gone virtual during this whole COVID-19 crisis and is adjusting to the new normal. So let's introduce our friend, Leamy. She's right here. Hello.
Hello.
She is the co-partner and sales director of Health Fairs Direct, which was born out of 20 years of experience. They provide on-site and corporate wellness programs across the entire country. They also provided more than 600 live events in 2019, which included flu shots, biometrics, corporate challenges, massage clinics, and so much more. So Maria, welcome to the Brand Ambassador Select Podcast.
Thank you. It's good to be here.
So tell us a little bit about Health Fairs Direct and how you are now managing during this whole COVID-19 pandemic.
Sure. So we've been running events for quite a long time. We started out with bringing in some local business people to talk to the people at the locations, and then we started enhancing that. We started to bring in flu shots and biometric screenings. We brought in some fun things like paraffin hand treatment, doing virtual reality gaming, things along that line. So we're really have just been really working hard to make ourselves higher than any of our competition. And we've been very successful with that. In 2019, that became our highest ever as far as our strength and how much we've had.
Yay!
We had about a 19% income from the year before. So we were like rolling, things were doing great. We had all these, good things already scheduled for the year. And then came the COVID.
Bam.
Curveball. Indeed. So I think everyone took a hit with that, right? We all have our challenges for that. But we pretty much then moved immediately into virtual services as best as we could. We started doing testing for the antibodies for the corporate clients. And we also went into the personal protective equipment business, basically. So that was our start, and we have been doing very well with all of those services. What's happened since then is we really, because of what was going on, we had to change everything. So
you had no choice.
There was no choice.
It's not even just you had no choice. I think everybody had no choice. Had to learn to figure out what the heck to do.
Right, exactly. What was cool about it, because there has to be a good side of all of this, right? So
yeah,
the good side of it is that it took us out of all the minutia that we were doing because everything was going very fast. And it gave us the opportunity to really be creative and figure out things that we can do that are going to help our clients still, because nobody's there yet, but we're in a panic of what to do. So that's where we've now brought in some other services. Just recently, we are starting up another type of testing for the antibodies and the COVID, and it's actually a rapid release. So
nice.
It takes like 15 minutes. And the way that the protocol is to get it done, it's just like a biometric screening. So we have trained screeners across the country. So we're ready to start bringing that out now too.
So with the whole COVID testing, I know you said you've been giving them to your clients. If you're listening right now and say you own a business, are they allowed to contact you to get any of those supplies if they're already not a client?
Yes.
Easy enough.
Okay. We just need a call or an email and tell us when you want to have those services, and we'll do it.
And small, large, doesn't matter, everybody in between.
There's a minimum, it's not too bad, and we can do that across the country. So, we're dealing with a corporation that has 22 locations, and we'll be at all of them.
Perfect. Now, you did say that you're going to have somebody you're going to have like a nurse or somebody actually perform these tests and do that accurately. How are you taking those precautions in the safety of not just your staff members, but your clients and their employees as well?
Mm-hmm. So we started that protocol right away. Our screeners have not only the gloves and the face masks, they have the shields as well. All of the tables are at least six feet away. one person at a time. People that are coming in, we would set up schedules for them, and so that we would only have a certain amount of people coming in every half hour. And that's worked out really well. It's been very, actually better overall, because there's less confusion with people waiting for too long, so they know exactly when to come and how long it takes.
So here, if you are watching visually and not just audio, we do have one of the care packages you are giving out today. It does say, your well-being remains our top priority. Please use this kit to continue to practice good hygiene. A+, Maria. Thank you for all of your commitment and support during this challenging period. Be safe, be well. And I see that you can insert company logos in there too.
That's right.
So tell us all about this care package and what comes in it.
Sure. So this is some of our products. We have some others that didn't come in, but we have a KN95 mask in there. We have one of the disposables as well. We included a 6-ounce hand sanitizer. Also, there's a smaller sanitizer that you were just holding on to. That's actually our own brand. It's called Refining Clean.
Perfect.
And it's perfect for, personal use. Put it in your purse, put it in your backpack, whatever you need for it. What's really neat is that we actually have our Health Fairs Direct logo on the packaging, so we're pretty proud of that. That's also the name of our website for the PPE products. It's refiningclean.com, and you'll see that there's actually a really good special on that particular one.
So if a company wanted to purchase more than just hand sanitizer and the packages, can they purchase from you guys, say, an abundance of masks or an abundance of just hand sanitizer and not everything specifically in this care package?
Yes.
And businesses across the whole, right? So if they want to be a new client, they can become a new client and join the Health Fairs Direct family this time?
Exactly.
Awesome. Okay. So how do you get your clients? Obviously, if you are listening and or watching, feel free to become a client and join the family as well. But over the years, how have you obtained such a large amount of people to join your family?
Sure. So about 95% of our referrals actually come from resources. So we've been working in the industry for so long that our people are, I'm receiving emails from people that I don't even know. And they're saying, Julie told me to reach out to you, and I don't even know who Julie is.
Julie, in what state?
Exactly.
In what zip code?
Right. So it's just because we have so much that we can offer, I think that's really where we're getting those referrals, and it's just going from one company to the next to the next.
So I know you are doing some virtual health fairs as well, and you pivoted from obviously in person to interacting with countless amount of people. How is the virtual side working out?
It's working out very well. Most of our clients that we worked with last year for their fall events, they're now taking on the virtual health fair. So we're in the midst now of getting everything scheduled up, just like we would have if we were going onto their office.
What started your journey? You are a co-founder, co-partner in Health Fairs Direct. Where did the idea spark from?
So someone gave us the idea, and we took that and realized that we can help so many people by running these events, because we're bringing them not only the educational component, but we're bringing in the biometric screenings or a blood pressure screening. And I'll tell you there's been a number of times where we sent people to the hospital because of what their results were for, in that case, it would be from the blood pressure. So for us, we feel like we want to help people. Everyone wants to help other people. We're doing that in mass, even if we're not physically there as a company, but all of our products and the people that we're bringing in are coming for that. How many people have we just changed their lives and they don't know it?
Hundreds and thousands if you're across the country at that point.
Exactly.
Now tell us I know you've mentioned biometrics about 2 or 3 times so far.
What does that mean?
Yeah, what is it? What does it mean? I know it's some like anatomy because it has bio in it, but
Right.
What is it?
That's fine. So it's a number of different tests that we do. So we would do a blood pressure check. We would do a body fat check. We would do a check with a finger prick, little piece of blood you got to take off. And that is for cholesterol and for the glucose, the sugar tots. So those results come immediately to the employee. Mm-hmm. So they'd be able to see if, let's say, they're borderline diabetic and they didn't know that. So that's how powerful that is. And what we do is at those events, we usually have someone available, say a nurse or a nutritionist, when someone hears that, and they're gonna be like, oh my God, what do I do? This is horrible. This sucks. My job sucks. It's bad. And it's like, no, it's not. It's fine. Come talk to this person. And that person can at least give them 1 or 2 or 3 things that they can do right away, allowing them to get control of the situation. And then they get to realize, like, okay, I'm not going to die. And I get it. I'm going to go talk to my doctor and I'm going to do something about it.
And that's exactly how you said you're helping people and maybe even save their life at that point.
There's been some of those.
You do offer a lot of services for your live health fairs and virtual ones. What is one service that you absolutely love and would highly suggest any company, any person to take part of at their health fair?
On a regular basis, outside of the virtual?
Yeah, I want the regular, whatever normal used to be,
yes,
and whatever our normal is now in virtually.
Sure. So I really like the paraffin hand treatments. Those really go well. It's fun to watch because once the first male gets into it, all of them get into it. So there's a little bit of that hesitation at the start. Because
it's not a beauty thing, but
it's a fluffy thing.
Because it helps your hands look absolutely gorgeous, by the way, and it also helps with the inflammation and stuff too. So there is a medical side to it as well.
Right, that's correct. And then on another side would be our nutrition stations. We do smoothies right on site. We do trail mix, make your own trail mix. We bring in a bunch of products that are gluten-free. What's the other one? GMO, non-GMO,
so everything
better
free
stuff. Exactly. And we'll bring them out as samples so that people can try these new products.
So once you start doing I know you're doing the testings now at certain locations for certain clients. Once they allow us, or companies are like, hey, Maria, I want an actual live health fair. I want paraffin. I want biometrics. I want anything else you have to offer. What are the precautions that you're going to take for the employees to then step into that facility or into that room that you're actually hosting your event at?
Right. Well, obviously we'll have multiple tables far away, probably fewer than normal. And we would have the protocol. Each of the stations that we have, they'd have, they're using gloves, they're keeping on their mask, they're sanitizing as somebody leaves. Something like the paraffin hand treatment is a good example. They're not going to be dipping their hands into the liquid. You're going to get a glove, a big, large glove, and we're going to put the paraffin into that glove and then sticks their hands in it, and that's how we set that up. So that's just one of examples of how can we be creative so that we can still get these services out.
What makes Health Fairs Direct stand out against all of your competitions and other health and wellness companies that are out there?
Well, the corporate health and wellness industry was designed so that certain things had to be done from the corporate side, and then other things had to be done in the wellness vendors coming in. So what we realized back in 2004 that we needed to take a different approach. And what we did really was to make sure that everything that's needed and wanted and put in the right place, all of that's our responsibility. Even if it's someone that, say a vendor, it's getting angry. Well, you know what? It's our responsibility. And we really set things up so that every event is going to be a really good event. And because we take that level of responsibility, those events do go well. And we've actually heard some of our vendors saying that we're the most strict, right?
In a good way.
In a good way. But they also say that we give them the best product. So, that's really important for us, for that. What we've been doing now, which is really cool, is because of the way that we do those types of events, that we're getting a lot of referrals from other people, which is really cool. And what's funny is that we haven't even kept it a secret, like how we set these things up. So, as a matter of fact, our CEO, John Buckley, published the American Academy of Podiatric Practice Management magazine. This was back in 2005, and he wrote an article called The Anatomy of a Referral and How to Create Them. And it seems like we're the only ones that took that advice.
Yeah, you put it out, like you said, you put it out there, so
right.
It's not like it's not public knowledge, but You're the only ones that are mastering it, at least.
Well, thank you.
So I love that you've been so positive, but what are some of the obstacles that maybe you personally, as like, in sales or as a co-partner, or the company as a whole has faced during this time? Because everybody's had their hiccups, everybody's had the, what do I do? Do you mind sharing an obstacle that you had to overcome?
So when this first started, we didn't do a lot of communication because everybody was just on that first couple of weeks. But then as I started reaching out to my clients, I couldn't get to a lot of them because the only numbers I had was the office. So then it was, trying emails, hoping we can, catch up to see you, talking with some, and they're like, I'm just so scared, I don't know what to do, so I can't talk to you. Like, there's a lot of that. And quite a lot also just the people now, they're working from home. And I had one of my clients say, look, I'm home, I have 2 kids, I'm working 10 hours, and I don't know if I can make dinner because there was just so much going on. So that I think is something that, a lot of households had to handle that.
Yeah, it was definitely difficult. Probably in your own households in itself. Like, you're working 10 hours and then you got the hubbies on the other side. It's like, where's my dinner? Or are you at least going to join me for the dinner that I cooked?
Right.
Like, even as little as that.
Yep.
So you can reach out to Maria at healthfairsdirect.com and view your email to mleamy at healthfairsdirect.com. That is MLEAMY at healthfairsdirect.com. And Maria, before we sign off today, what advice do you have to because you are a small business here in New Jersey, what other advice do you have towards other local businesses and corporations to really help bring them up during this time?
So I think right now it's getting part of it would be what the mayor is saying, like where we are, the governors. But we really need to get people back. And that's what we're offering, like those anti-testing and all of those. That's what's needed so that people are going to feel comfortable to come back in. So that's really what we're hoping to help achieve.
So thanks for doing your part in the community and helping all of us feel safe, and even feel safe like going back to work or even to a supermarket, a party, just to kind of know that okay, well, I know I'm okay. I know I'm not sick, even though sometimes during this whole period we're like, I got a cough. Uh-oh. Do I got something? Do I not got something?
Is that an allergy?
Yeah, and honestly, all of mine have been the allergies because this pollen count and this temperature has not been nice to me these days.
Yes.
I don't know about you, but
Well, there were a number of days where every few hours I'm putting that thing on my head.
do I have 100.4? No, I have a 99.6. Okay, it's probably because I'm sweating. Gotta turn that air on super duper high. So Maria Leamy, thank you so much for joining us.
Thank you.
So co-partner and sales director of Health Fairs Direct. If you're looking for a health and wellness event or even virtual, live, anything, some PPE packages, some care packages, everything, they have it for you at healthfairsdirect.com. Once again, you can reach out to Maria via email, mleamy at healthfairsdirect.com. That is a wrap on another episode of the Brand Ambassador Select podcast. I'm your host, Lenore. Head to brandambassadorselect.com to subscribe and for all the information that you need, and we will see you next time.